Hello everybody, Darren Reeves here, President DP Distribution and Consulting for another DP Minute. We have now hit comment number 50. So we have 33 more to go, but let's focus on 50 right now. In comment 50 of the QMSR preamble, it states, multiple commenters suggested that proposed 820.10 was overly burdensome. One comment stated that the requirements found in previous 820.65 of the QS regulation were less burdensome than the requirements of ISO 1345 clause 7592. And if you remember, that is the one for the particular requirements for implantable medical devices. Another comment suggested that the perceived increased burden would itself cause devices to be less available. A comment was concerned that this provision will increase documentation requirements and is redundant with the established processes. Some comments noted that it may be difficult for manufacturers to maintain records of components and to comply with these requirements for devices incorporating off-the-shelf technology. So there's a lot there. They're really concerned about what traceability requirements are there going to be for implantable medical devices. And some commenters think that it's going to be overly burdensome comparing the ISO 1345 to the QS regulation. FDA's response, we disagree that it will be overly burdensome for manufacturers to comply with this provision. The traceability requirements and the manner in which they are applied in the QMSR and FD&C Act and in its implementing regulations are substantially similar to those found in the QS regulation. So as most people out there know, whenever the FDA puts in a new regulation, they have to assess it for its burdensome capacity to the industry. So this commenter stated they thought that this was going to be overly burdensome, and the FDA said, no, we disagree. We also have considered the comments regarding the requirements that manufacturers maintain records of components that could cause the medical device not to satisfy its safety specifications and effectiveness requirements, and we consider such records to be essential to a comprehensive QMS. So they're not saying you have to control all the components, nor do you have to trace or track all components. What it's saying is you actually have to address the traceability requirements of those components that affect the safety and performance now, or safety and effectiveness of what it used to be, of the finished medical device. So that's where they're saying that the components come in. Similarly, we recognize that other jurisdictions may have requirements for medical devices that are similar to those in 820.10 and the QMSR, and those similarities were an important consideration in incorporating ISO 1345, and here we go again. We note further that this is consistent with our goal of harmonizing to the extent possible FDA's QMSR requirements with global standards and the requirements of other regulatory jurisdictions. So there you go. They're trying to keep ISO 1345 intact by incorporating it into the QMSR by reference. This is Darren Reeves, and thank you for watching. We'll see you next time.